see about essential newborn care. So what is the meaning of essential newborn care? When a child is born, so there are certain important aspects to be looked into. First is born. The child should not go for hypothermia, for which you need to cover the baby. Then you need to look into the baby three aspects. One is whether the baby is a term baby or not, and whether the baby is crying or not. When the baby is crying, it indicates child is breathing. Understand? And whether the child is maintaining good muscle tone or not. When the child is maintaining good muscle tone, that you can realize when the child is moving the body with all the extremities. So when it is done, the baby doesn't require resuscitation. Child is a normal newborn baby. You can just place the baby in a pre-born towel. Just place the baby on the abdomen of the mother. Okay? And apart from that, you need to look into the other aspects like vitamin K and tying the wristband. All that can be done. So let's see what are the items to be kept ready before the baby is born. The temperature of the labor room should be 26 degrees Celsius. About 26 degrees Celsius, you need to maintain the labor room temperature. And half an hour before the birth of the baby, the radiant warmer should be on. Okay? So under the radiant warmer, you need to keep 3 towels for pre-warming. You need to warm the towels to receive the baby. And you need to wear your PPE. You have seen me wearing the PPE along with the gloves. Okay? So I am wearing the gloves now. Then apart for the normal newborn baby, you require to have certain so here in this tray you can see there are 2 artery clamps which are kept. Then suction catheters are kept. There are 2 types of suction catheters, 2 sizes of suction catheters we have kept. And this is a mucus sucker, Deely's mucus sucker we used to say. Understand? This can be used in the community where suction main port is not available. Understand? Electrical suction port is not available. You can use this. This end will be, you will be keeping it in your mouth. So how do you suck your juices? Same way you need to suck. When you suck, this end will be on the mouth of the baby. So what is happening? You are creating a negative pressure, and in this box you can see the mucus is getting collected. As a routine, please keep it in your mind. As a routine, don't do suctioning. When there is secretions in the mouth, then you go for suctioning. As a routine, never do suctioning. Understand? There is no need for suctioning of the baby. As a routine, I am doing suctioning, not required. When there is a secretion, go for suctioning. Understand? So this is Deely's mucus sucker. Okay? And then you have artery clamps. 2 artery clamps are available, and the umbilical cord. Apart from that, you can see umbilical cord clamp. Then this is the yes, for ID, and this is for the normal newborn baby. When you receive a normal newborn baby, these things will do. In case if you expect the baby is not crying, so you have to be ready for that also, right? So for that sake, we have kept 2 ambu bags, different sizes of with different size masks. This is 0 size mask, okay, and this is 1 size mask. Okay. So this 1 size mask, this is for the term baby, and 0 size mask, this is for the preterm baby. Understand? So how to fix the mask in? So you need to just hold this inlet. This is the inlet of the ambu. So there is an opening here inside the mask. There you have to keep your thumb. Okay, just hold it like this. Otherwise, it will get rotated. If you do it like this, it will not get fixed properly. So just keep it like this. Just rotate. So it will get fixed properly. Understand? This is how you have to do. Why are we checking everything, whether it is in working condition or not? Just keep it against your palm and then check. there is a fish mouth, yellow color. You can see the opening of how fish mouth is getting open. Same way it will open and close. Are you able to see? Yes? Yeah. So, move the amber bag, you need to check and keep it ready. And then you can see like a spoon-like device. This is called as LMA, laryngeal mask airway. So before intubation, if there is a problem in intubation, you can use laryngeal mask airway. It is easy to introduce. This should be, we are not introducing, but we have to keep the things ready, emergency things ready. And you can see different sizes of ET tubes. This also should be kept ready in the tray. And there are different sizes of airways which are available. You can see the tiniest one airway. This is very tiny, right? Sometimes if the baby is born less than 1000 grams, 1 kg, in that case you need to go for this, the smallest one. And you can see different sizes of other airways to prevent the tongue falling back when you are introducing the ECQ. And then you can even do the suction through the airway. And these two, do you know what it is? There are markings available in the outer tube, and one end is closed. Huh? Yeah. This is the nasogastric tube. We can introduce orally. Usually in the newborn, it is introduced orally. Orogastric tube, we usually say. Here also there are various sizes, and you can see here. What is this? Any idea? Laryngoscope. So laryngoscope, this is the handle and this is the blade. So for this is size 0, which will be used for the preterm baby, and this is size 1, which will be used for the term baby. We need to check even this is working or not. Okay, there is a groove here, so just fix it and pull it forward. You can see the light is working, right? So this indicates this is in working condition. Why are we keeping everything ready is at the last moment we cannot be running around. For that purpose we are keeping everything ready. And there is a mask as well as you have to have a, what is this? Oxygen probe. And pulse oximeter, if it is available, you can use that also. Understand? These are things we are keeping it ready. And vitamin K, I have told you, even adrenaline is being kept here, so that if there is a requirement, you can give adrenaline, normal saline, sterile water also to dissolve, it is available. Understand? So now let's see how to do the deliver the baby. Delivery already you have seen now. From the phase of delivery, what else are we doing? So usually the child has delivered and I am just receiving the child in a pre-warmed tub. Right? So the baby is delivered in a pre-warmed towel. So what I am doing, immediately I am looking into already 11:39, I just noticed, and immediately I am just, child is crying and muscle tone is good, okay, baby is moving. So what I am doing, I am just placing the child on the mother's abdomen with the pre-warmed towel. Understand? So what I am doing with the pre-warmed towel, what I have placed on the top of the back of the baby, I am just drying the baby. Okay? After drying, this is wet, so I am just removing the sheet and I am using the other pre-warmed towel to cover the baby. Understand? Now it is almost, why I am doing this? The child can initiate feeding, bonding, all that it is happening now. And mother also will be comfortable. And I am just showing the mother or the gender of the baby. Okay, this is a male baby, I am just showing. So, and then what is happening? Next, now there are two things you can keep it in your mind. When to cut the cord? Cord can be cut after 3 minutes of the birth, or what you can do is once the pulsation of the umbilical cord, when it stops, you can cut the cord. Okay, I am just checking the pulsation of the cord. It is stopped. Okay, so I am just trying to cut the cord. So I can just place a child next to the mother. Okay, still the placenta is inside the mother's uterus. Okay, so how I am doing it? So there is no suction. If there is no suction, don't do the So there is no secretion, so don't do the suction as a routine. So I'm just keeping 3 fingers from the abdomen and then I'm placing the first clamp. Okay. Next clamp I'm keeping after 3 fingers. Okay. So then I'm placing the umbilical cord clamp. Then I am cutting the cord. Okay. After cutting, what I am doing, I am just placing the child. I can give the vitamin K now. So already cord is cut. One end is with the mother, right? It's still not come out. So she'll be loading and giving me. So I am just giving the. So vitamin, I can immediately. I am checking the. Loaded. Yeah. So vitamin K I am giving. How much of vitamin K? Because the child is more than 1000 grams. I am giving 1 milligram. In IM vascular flattalis, I need to give the vitamin K. So I am checking any congenital anomalies is present or not. Nothing is present. So I am giving the vitamin K injection to the child. Understand? So next, I am just placing the child on the abdomen of the mother. Okay, this is essential newborn care. Child is not having any problem. Child is crying. Child is a term baby. Child is having good muscle tone. Okay, there is no secretion, no suction is required. So we are seeing the time. We are seeing looking into the child in congenital anomaly. These are the extra points you need to remember. Temperature of the room should be above 26.0 Celsius, and you need to look into whether the child is term baby, child is having a good muscle tone, and child is crying or not. Okay, show the genitalia to the mother so that it is confirmed that mother is knowing the gender of the baby. And wristband you need to keep in the hand of the child. Okay. So once everything is done, what is my role? I need to record. Everything I'll be recording. I have already weighed the child on weight of the baby, so everything I'll be recording it. This is about normal newborn or essential newborn care. Any doubts? Okay. So the second area. So now the second area is the child is not crying. When the child is not crying, what we must do? Okay. So I have received the baby and child is not crying, but child is a term baby. But child is not crying. What should I do? So immediately I clamped and I removed I separated the cord with a cord clamp. Now I am taking the baby with a pre-warm towel to the radiant warmer. Okay, radiant warmer. So since you may not able to see what is going to happen here, I am just showing you over there only on the table only. So it should be done, resuscitation should be done on the radiant warmer. Okay, so now immediately I am just placing the child on the radiant warmer. I am keeping the shoulder roll at the shoulder level. I am keeping the shoulder roll on the shoulder level is to open the airway, and then I should do the suctioning. My next action should be suctioning. I will be doing the suctioning. First, mouth should be sucked and then nostril should be sucked. 2 to 3 centimeters I will be inserting. Okay, same catheter. Why I am doing the mouth first is, if you are going to do the nostril, what will happen? The vagal nerve is getting stimulated. So in that case, what will happen? Whatever amount of secretions will be there in the mouth will get aspirated. Child will go in for problem. So to prevent that, always suction the mouth first and then the nostril. Okay, and then you have to dry the baby. So child has not cried still. So drying the baby. When drying the baby, this is the way of stimulation. Okay, tactile stimulation. So what is happening with the tactile stimulation? Some of the baby may start crying. So now child does not cry. So what should I do? This is wet. This cloth is wet. So another pre-warmed towel I should place, and I should say everything that I should place, and again I have to position the baby. Okay. So next one is, what should I do? I have done the suction, I have done the stimulation also. Now I have to check the heart rate of the baby. I have to check the heart rate of the baby. So before that heart rate is 7. We can't be checking for 1 full minute, that is 60 seconds, because first 60 seconds are being called as golden minute. So we can't be wasting our time. Within 60 seconds we should start the PPV. Understand? The PPV, partial pressure ventilation, should be started within, positive pressure ventilation should be started within 60 seconds, so that you can survive the baby. So in that case, what we have to do is, we have to check for only 6 seconds. So 7 was told by the heart rate, it was the heart rate. 7 should be multiplied by 10, you will be getting the number. If it is less than 100, it was 70, so less than 100, give only positive pressure ventilation. Okay. If it is less than 60, go for compression and your ventilation. Understand? So when you are giving the positive pressure ventilation also, you have to hold the ambu bag like this. Okay, this accommodate around 250 ml of air. Okay, and this is the oxygen inlet, and this is the inlet to the baby. Okay, through this the oxygen is being, environmental air is being utilized. Now it's going to be delivered to the baby. And you have already checked whether it is in working condition or not, and how to hold. You have to remember C and E technique in alphabet. C is, this is C. Okay, with your thumb finger and your index finger you are making a C. Okay, hold it like this. Okay, there should not be any gap. Mask should be holded tightly. It should be sealed over the mouth and nose of the baby. And this is E with the 3 fingers. Middle finger, ring finger and index finger. With that you are just holding the chin and you are lifting the chin. Understand? So now I am going to cover the nose of the child and mouth of the child, and then C technique and E technique. I am just lifting the head up, and there is a way of giving ventilation. Okay, sequence should be squeeze 2 3, 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 squeeze 2 3. So 5 breaths should be given within every breath should be given for 2 to 3 seconds. So 5 sequence of breath should be given initially. When you start the ventilation, 5 ventilation should be given. So now heart rate should be checked again. Now it is 5. 5 into 10 is 50. So if 50 means less than 60 it is. Now we need to go for compressions, right? Now because this is the term baby, she is going for thumb encircling method. Okay. So there is a sequence again here. 1 and 2 and 3 and breathe. When she say breathe, I have to give a breath. Understand? Yeah. 1 and 2 and 3 and breath. 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 Yeah. Now 30 seconds. I should continue for 30 seconds. 9. So 9 is 90. So I should give only PPV, right? Only ventilation is required. So my sequence will be squeeze 2 3, squeeze 2 3, squeeze 2 3, squeeze 2 3. This should be given for again 30 seconds. Again check the heart rate. It is 10, 100. So can I stop it? I cannot stop. I need to wean the child from the ventilation. So how it should be done? Again there is a sequence. So So squeeze 2, 3, squeeze 2, 3, squeeze 2, 3. This should be given for 3 sequence. Again, squeeze 2, 3, 4, squeeze 2, 3, 4, squeeze 2, 3, 4, 3 times. Again, squeeze 2, 3, 4, 5, squeeze 2, 3, 4, 5, squeeze 2, 3, 4, 5. 3 times I should do. Again, check the heart rate. Again, folks, every time heart rate should be checked for 6 seconds. 11. So the baby is maintaining the ventilation. So I can stop ventilating the baby. Now what can I do? Because it took a prolonged ventilation and compressions were given, the child should be shifted, covered with the pre-warm towel or more towel, and the baby can be shifted to the NICU for additional thing. If the baby is not recovering from the heart rate is not picking up, in that case the child may require intubation, okay, intubation, and we can immediately, anesthetist will come on call, so they will be intubating the baby and they will shift the baby in transportable ventilator. Understand? This is how it should be done. If you are giving only PPV, with the PPV the child has picked up the heart rate, there is no compression involved. That case, just cover the baby. Child is okay. Wean the baby, immediately 2 minutes, you are giving only the compression the heart rate. Immediately what you can do is, you can just cover the baby with a pre-warm towel and just place the baby and do the additional things, whatever I have told you, like the baby can be, the baby can be given vitamin K injection, check for additional anomalies, weight of the baby can be checked, wristband can be done. This is how it should be. So what you have to remember now is, whether the baby is a term baby, whether the baby is crying or not, whether the baby is having good muscle tone or not. These 3 things you need to look into. Term baby, that you are aware. So these 2 things you have to look into. Within 60 seconds, it is a golden minute. Right? First minute is a golden minute. So if you are starting the PPV within 60 seconds, you can survive the baby. That is very, very important. Initially, place the child with the pre-warm towel under the radiant warmer. Then raise the chest end with the help of your shoulder roll. Sniffing position it is called as. You can maintain the sniffing position. And then you can do the suctioning first. Mouth suctioning and then nose suctioning. Later you can go for drying the baby. Okay. It is a way of tactile simulation. Then remove the cloth, change the cloth, and then again reposition the baby with a shoulder roll and start, check the heart rate, and then do the PPV for 5 continuous PPV. Ventilation should be given. The sequence should be, so the sequence should be squeeze, just keep it. So the sequence should be, it is squeeze 2, 3, squeeze 2, 3, squeeze 2, 3, squeeze 2, 3, squeeze 2, 3. 5 times I have given. Then again we are checking the heart rate. I am showing you so that the expansion of the lobes, how it is happening, you can see in this. Understand? So this is what initially we are doing, checking the heart rate. If the heart rate is less than 60, go for compressions that we have already demonstrated. And then again we are doing for 30 seconds. Again you are checking the heart rate. If the heart rate is more than 100, in that case, don't stop abruptly. You can go for again weaning. The weaning should be done how? Squeeze 2, 3, squeeze 2, 3, squeeze 2, 3, squeeze 2, 3. Squeeze 2, 3, 4, squeeze 2, 3, 4, squeeze 2, 3, 4, squeeze 2, 3, 4, 5, squeeze 2, 3, 4, 5, squeeze 2, 3, 4, 5. Okay? With that we are stopping the ventilation and checking the heart rate. Now heart rate is maintained above 100. Is it clear what is now? If the child is not you have not given compression, shift the baby to the mother side. If compressions are given, you can shift the baby to the NICU with appropriate